This condition is called Radia?
Yeah.
This condition is called aortic dissection. Aorta is the biggest and main blood vessel that comes out of the heart and then supplies blood to all over the body, including organs and tissues. Now, if the integrity of this aorta is lost, then patient is at risk to die or get into complications. What we did today is using a combined operation and stent technology, which is called hybrid procedure. We saved this patient by protecting the head and neck blood vessels so that the brain is protected, and then the patient was taken to cath lab to place the stents so that the dissection is completely cured. In the past, we used to use only surgery to cure this problem. However, the patient used to develop complications. They had hospital stay which is longer than a month, and then the very slow recovery, and the risk also, operative risk was also very high. Today, because of the technology and the hybrid procedure, the recovery is very fast, and then the complication rate is much less. Unfortunately, because of the new technology, the costs are very high. Each stent will cost 6.5 lakhs, and by placing 2 stents plus surgery, it costed above 15 lakhs. However, as the experience goes up, the technology is available more widely, certainly the costs are going to come down. Currently, our operative mortality is around 15%. That means 85% of the patients will survive without any problem. With the new technology, we're expecting this rate to drop to less than 5% and hopefully even less as the experience builds up. This patient is 42 years old, and he came in within the first 6 hours after having had the dissection, after having pain. Mainly this particular problem affects the 30 years and up to 60 years, and cause of it is atherosclerosis and Marfan syndrome. Mainly the symptoms are almost like heart attack, like severe chest pain, but peculiar to this is that this chest pain radiates to the back. Between the two shoulder blades, they feel severe pain, and it won't subside, and it is an ongoing continuous pain until something is done. The patient neglects majority, 50% of the die within the first 48 hours, and then there are late deaths. Almost all of them will die within the first few months of dissection because of the compromise to the organs, blood supply to the organs like brain, kidneys, particularly intestines, and sometimes even to the heart. The bleeding happens within the heart, and then the patients will die eventually. This particular stent is from Australia, and there are stents available both in Germany and US.